Hello, and welcome to Dartmouth-Hitchcock's relaunch of our popular Roundtable series, Heads Up, Coping Through COVID-19. I'm Audra Burns, Media Relations Manager at Dartmouth-Hitchcock, and your moderator for the series. We created this series at the onset of COVID-19 and recognized that there was a need to bring back the series to address the ongoing challenges brought on by the pandemic. Today, we embark on the next of our 9 conversations featuring Dartmouth-Hitchcock experts and others. And today's segment will focus on the experience of having COVID-19. I'm joined today by Dr. Elizabeth Talbot, Deputy New Hampshire State Epidemiologist and physician in the section of Infectious Disease and International Health at Dartmouth-Hitchcock, Dr. William Torrey, Interim Chair of the Department of Psychiatry at Dartmouth-Hitchcock, and Jennifer Saucier, an elementary school physical education teacher in Merrimack who contracted COVID-19 in November. Thank you, Dr. Talbot, Dr. Torrey, and Jennifer for joining me today.
Thank you very much for having us.
Thank you.
So Jennifer, to kick things off, can you tell us about what it felt like when you received your COVID-19 positive test results, and what was it like when you had to tell people?
Well, I was always someone, still am someone who really takes this serious. And I wash my hands, I wear my mask, I keep my distance. And when the way that I figured out that I had COVID was I just felt off, like my whole body felt different. And I took my temperature, didn't have a temperature, but knew that something was different. And so I went to a facility that did a rapid test and thinking I would be cleared and be told that it was, just a cold or I was run down, worn out. And then I got the news 30 seconds after I took the test that I was COVID positive. And at first I thought they had the wrong room. They came into the wrong patient. And they said, no, like for real, you have COVID. And like, how can this be? I was part of the team that helped reopen my school when we were going from full remote into hybrid learning. And I was so cautious. How could this happen to me? And I think the first time that I realized how serious that other people would see, or like almost like the stigma behind how they would see me, was when I went to check out after receiving my test, and the receptionist, I handed her my debit card, and she was like, "Oh no, I can't take that. Can you read me the numbers?" And like, oh my gosh, like I'm contaminated. Like I felt poisonous almost, and then I started calling people in my immediate family and my close friends, and come to find out that 4 out of the 5 people that I spent the weekend, I went to my parents' house for just a small birthday party for my mom, and 4 out of the 5 of us got COVID. It was really strange. I don't know how or from who, but we all contracted it. And then when I had to call other people and say, whether it was my school, some close friends, like, hey, by the way, you may want to keep on the lookout, maybe you want to quarantine, because I'm like a first generation contact with COVID. Some people were, saying, what can I do? How can I help? And then I also had other responses like, why? How come now I have to quarantine? My plans are ruined for the weekend. And it was almost like I was embarrassed. I was ashamed. And it was just a really weird sense of feeling, saying, well, why did this happen to me? And now I'm ruining other people's weekends. And I could end up in the hospital. Fortunately, I'm one of the lucky ones that I'm able to be here and talk about my story. But at the time, I had no idea, what was going to happen. And it was it was a very, very difficult couple days just to kind of like tell people, and especially knowing that I was someone who really took this serious.
Mm-hmm. Well, we're so glad that you're doing better and you're sharing this story, because I think, you know, one of the things you said, you let your guard down with your parents. You had been so cautious, and how quickly that happened on that one moment. And Dr. Talbot, with, you know, after a person tests positive like Jennifer did, you know, what can they expect, and how can they keep their loved ones or their roommates safe while they're quarantining at home?
Well, first, thanks so much, Jennifer, for sharing your experience. It's quite generous and courageous of you to do so. I think it'll benefit a lot of persons to know how that goes, really. Formally, after a person tests positive, it generally gets pretty real when their result is automatically reported to the public health authority in their state of residence. And then after that, the trained public health investigator will call you. And you said it first became real when you handed it or tried to hand over your debit card. But in fact, for a lot of folks, that's when it does become real, talking to that person at the state. The purpose of that call is to enable the patient to maintain isolation and to appropriately care for themselves while they're riding that illness out. Another routine part of the contact that you have with public health seeks to identify the people who might have been the source of your infection, but also the people who may have been inadvertently infected by you. It can feel intrusive, but I think that the system has now gone through a lot of experience and routine operations so that you will likely find it understandable and helpful even. So within that encounter, a person who's testing positive receives instructions. There's links, we can mail it, we can point you to those. And also instructions for isolation, and also instructions for quarantine for those maybe in your household. How do you keep your household safe? You know, those are really generous and good questions. First off, we want people who are infected to stay at home. When you live with other persons, yes, there's a risk that you might transmit to them, and therefore we ask you to try to physically separate from the persons in your household, even to try to use a separate restroom whenever possible, and to clean commonly touched surfaces like doorknobs and the like. There's a lot to say about that. And again, there's now a routine of it where a lot of this is written down to make this easier. But I, again, thank you for sharing your experience. And I think that's going to be very helpful for persons.
Yeah, and Dr. Torrey, Jennifer mentioned, you know, the stigma that kind of came with it and the anxiety. So how can people who test positive, you know, cope with the stigma and the stress that may come up with themselves and others when they're sharing the news that they've tested positive?
I think Jen's experience is really pretty common. You know, people really suffer from COVID. They suffer from the symptoms of the illness. They suffer from their own worries that she described about what's going to happen next to me. And they also sometimes suffer from the way that other people react to them when they tell them that they've been diagnosed with COVID. It's actually true of many serious infectious diseases that they all cause a great deal of fear, and people are really afraid of COVID. And when any of us are afraid, we're at risk of not reacting with our best selves. So people may react with caring and concern, but they could also react with social exclusion, rejection, blame, devaluation. Those are what's called stigma. And these are really common with lots of infectious diseases, people blaming the person instead of the disease. It's really a reaction of fear. So distancing yourself from feared infections is understandable from an evolutionary perspective. You want to stay away, but it's really painful and confusing when you're getting the brunt of it personally. And it kind of piles suffering on suffering. So stigma is a real issue. It's important to address it. Sometimes it drives people from seeking help when they really should be getting help, and it can discourage people from taking the steps they need to be taking to protect themselves and others. So telling other people that you've been diagnosed with COVID just is stressful. You should know that up front, and there's really no way around it. And it helps if you do some planning for it. If people, so that's part of what we hope might come out of this. So here's some ideas. So you might anticipate that some people will react with fear rather than their caring selves. So you want to try to set up the conversation to maximize the chance that they'll react in a compassionate way. So you might say something like, I'm calling you to let you know that I've been diagnosed with COVID. I was careful with precautions. I really didn't sign up for this illness, and I don't feel that well, and I'm asking for your support. I'm letting you know because I would like your support, and also because your health is important and matters to me, and I want you to have all the information that you need going forward. And then directing people, answering their questions. If you don't know, saying you don't know, but directing them to factual information, because you really want to fight fear with facts. So, thinking about it, it might be helpful for all of us to think about how we would react when a loved one or someone we care about tells us that they have COVID. Because, if we're more prepared, we're more likely to respond compassionately. And, because I think, people suffer, and how much they suffer depends in part on how we all respond at the moment.
That's excellent advice. And I think responding with compassion is something so important that we need to remember during this trying time, because there's so much that the COVID positive person is going through. And Jennifer, you're young, you're healthy, you're not necessarily the demographic that people often think would get COVID or who would have bad symptoms. So can you share what kind of symptoms you experienced, and are you still experiencing symptoms now that you're recovered?
Yeah, so like I said earlier, I didn't have a fever higher than 99 any of the time that I was sick. And so some people were, I think a lot of people think that they're experts in this field, even though they're not. Just because you watch the news doesn't mean that you can tell someone that their symptoms are true or not, are real or not. But I didn't have a fever, but I felt awful. I couldn't get out of bed. I got really like down on myself. I coughed a lot. Just in the time that you really truly need a hug and to have someone tell you that everything's going to be okay, I couldn't have either of those. Like I couldn't have a hug from my family members. No one could tell me, you're guaranteed to be healthy. Like, you're going to be okay. Like, who's to say I am? Who's to say I'm not, but so I finally started to feel a little bit better towards, say, like after a week, even though I had very little energy, was still coughing. I had an oxygen meter, one of the O2 tests, and that was like one of my best friends, because I just wanted to make sure that, as someone who's healthy, I've run marathons, I've run half marathons, I coach running programs. Like I'm healthy, I'm very healthy. And to know that, like, there could be blood clots that form in my body. I could be experiencing things with my lungs, and to just be aware of how my body is reacting to this virus. But towards the end of my positive, when I had my viral load, I thought I could do laundry. I put myself out there, and I was like, I'm going to do some laundry. I'm going to make myself a human. Like, I'm going to be an adult. And I nearly passed out. I had to lay down on a tile floor, checked my oxygen. It was like real low 90s. And I realized, hey, you know what? I'm not ready to go 100% back in. It's not like the flu, or not like a cold where you can take some medicine and then function. Like I had a hard time being a functioning adult for a while, even after I was cleared to go back to school. It took me about another 2 weeks to recover and get a little bit of stamina. But now I cough every night. I can't control it. I have brain fog, like whether it's short-term memory or word retrieval. Like sometimes I just can't place the right word. And, you know, being an educator, I know that we're told to allow processing time for students and to make sure that they're able to get their thoughts together. And now I feel like as an adult, like I really truly need this processing time, because I get really frustrated when I can't say what I want to. And then I get like just the anxiety of how long is this going to last? When is this going to go away? And in a world where you can Google search anything, you know, instantly, I want to, and I have, how long will my long hauler symptoms last? And there's no answer. And that to me causes anxiety. Like, is this going to be something that I'm going to have a hard time, you know, running for the rest of my life? But then again, I think I shouldn't be worried about this because I'm alive, and that, you know, I am able to work. I am able to be healthy, see my family. So then I think, well, is this wrong that I'm thinking this way? And it's just, it's a very weird situation, and I wouldn't wish it upon anybody.
And it's so important that you're sharing this. And I think what you've just shared really emphasizes the fact that, you know, we need to still have those precautions of wearing masks and socially distance and hand washing, because just because you're young and healthy, you know, doesn't mean that you're going to be okay. Like it impacted you, and it's such a powerful message that we need to take those precautions, because we just don't know. And just when you're recovery, like you said, you're still dealing with some symptoms, and we just don't know what those are yet. So Dr. Talbot, you know, speaking about Jennifer's you know, experience with these long haul symptoms, what are some other common symptoms with, you know, COVID long haulers, and what is being done to really help them?
Sure, it's a great question. And again, I thank you for sharing this, Jennifer. So to frame it, most people who have COVID-19 recover completely within a few weeks. But we're recognizing that a substantial portion, even those who have had very mild versions of the disease, continue to experience symptoms even 4 weeks or months after their initial recovery. So it does seem as though the name for this as long COVID and the people experiencing long haulers is catching on as we learn more about it. For example, it seems as though certain people are at higher risk for long COVID, like those who are older, those who have other kinds of medical conditions. Those who experienced more severe disease, especially those who had to be hospitalized, are the most likely to experience lingering symptoms. But as Jennifer's described, even young, otherwise healthy people can feel unwell for weeks or months following infection. And the most common signs, most common things that happen to people is feeling tired. You described feeling tired going up to do your laundry. Some people feel like they can't get their breath. Some people have lingering cough, if that was a part of their initial syndrome. Sometimes joints ache, chest pain, muscle pain, headache. These are all being reported within long COVID. Many of you have heard of the fact that some people lose their taste and or smell during the acute phase of disease. That can happen during long COVID too. Either it just doesn't get better, or it even occurs during the weeks and months after disease. And then you mentioned brain fog, Jennifer. I think that's a really important, significant part of what's happening in long COVID. People describe memory problems, concentration problems, sleep problems, new insomnia, depression and anxiety can happen, and PTSD, post-traumatic stress disorder, for those who wound up being hospitalized. So a lot of things are happening, a lot of research being done to help us understand this better, and we're going to know more in time. We're going to learn how to treat patients when they have long COVID. In fact, some large medical centers are opening specialized clinics to try to do some of that kind of specialized care. And I think what I hear in persons describing their syndrome also is sometimes not being believed or well understood by their loved ones. It's another example of how people can feel stigmatized with their illness of COVID. So I think hearkening back to the notion that we need to have compassion toward people suffering with this disease out weeks or months, and also humility that we don't know everything we need to know about this infection yet.
Mhm. Absolutely. And Dr. Torrey, what are some techniques that you could share that may help people who have COVID and how they can deal with the stress, anxiety, and the loneliness of, what they may be facing?
So, whether or not you develop COVID is really a very stressful condition. Just the anxiety around your health, loved ones' health, economic trouble, isolation. And if you have COVID, feeling ill on top of that makes everything worse. The studies really are showing that people are experiencing significant anxiety and depression and PTSD from COVID. Healthcare workers, even those that don't have it, have these at very high rates. So what can you do? What can help? Social support is just hugely important for all of us all the time, but particularly when ill. So seeking out the support, trying to stay connected, asking for help from people that you have in your world, whatever supports, that really is important. And trying to be compassionate with yourself. I mean, I think this is something, I know when I'm sick and I'm mad about being sick. So I think a lot of people, expect a lot out of themselves. And so trying to be compassionate. You didn't ask for this illness, reminding yourself you didn't ask for this illness, and you certainly didn't cause this pandemic. Understanding that having confusing feelings is natural in a situation where that's confusing for all of us. And if you can, to the extent possible, remind yourself that, we're all everyone in the world and all across the globe is going through this together, and that we're kind of trying to face this pandemic together. The more we can kind of be together in it, the better. So use available resources, the people in your life, trusted guidance from the internet. There's a lot out there, but some things are really valuable and worth that are, can be trusted. We can put some of that on the website. But things like there's the Anxiety and Depression Association of America has a Coping with COVID in the Community, page that is quite helpful, things like that. Of course, avoiding drugs and alcohol because they make things more complicated, trying to fight fear with facts. And then if for people that are, not terribly ill, just trying to make some plans for the period of isolation. Is there something that you can do that you've wanted to do? So, so that you can have some sense of getting into the driver's seat and getting something out of it as a side benefit. So trying to see if there's anything you can do. Those are all sort of things that seem to be helpful.
That's great. I really like the fighting fear with fact, and we'll be sure to link the resources as well for everyone who's watching. So Jennifer, before we wrap up our segment, can you quickly share any quick advice that you would give to other COVID positive patients who are currently dealing with some issues currently?
So I've always been someone who likes to help others, and but with this in the stigma, I was so hesitant to even talk about it with anybody. And I donate blood regularly. And the Red Cross does do antibody testing. At the end of your blood donation, they just take a couple vials of blood and they test for antibodies. And all year I was negative. And then recently I donated on the end of December and came back positive for antibodies. And I thought, hey, you know what? This is my chance. This is my chance to make a difference, to share my story, and to help other people who might be experiencing some of the stigma and the mild, long COVID symptoms, and to know that they're not alone. So I posted on social media my story for the first time, saying I'm not trying to be a victim. I want to be a survivor. I want to help others. And the support I got back, whether it was thank you for sharing your story, I had it too. I was afraid to talk about it. And what would people think of me? Like, I teach 500 children, but because of my precautions and my living cautiously, I always kept my 6 feet. I always wore a mask. I always washed my hands, and all of them were safe, But anyway, so the Red Cross contacted me, saying that I was positive for antibodies, and I have an appointment in a couple weeks during my February vacation to go donate some convalescent plasma. And so I can use my superpower, as my doctor calls it. I should be walking around with an A+, like, antibodies positive, as a power. And so I will donate as often as I can until we get rid of this horrendous virus. But please know those people who are either experiencing COVID for the first time or have been quarantined because of loved ones, reach out to them. I know because of HIPAA, you're not supposed to really share a lot and talk about it, but FaceTime does wonders. Text messages, check-ins. I had some family members, deliver soup. Just little things that let you know that, or little things that you can do for others to let them know that you care about them and that you love them. And we, like you said, Audra, like, we're in this together as a whole world. And it takes all of us to make a difference and to change this. So whether it's the stigmas or the actual disease, so the support, we're all in it together. And I just want people to know that there are people out there that could help with whatever situation that you are experiencing, and that you do matter.
And thank you, Jen, so much for sharing your story. You're really helping us to destigmatize COVID-19, and we truly appreciate it. And thank you for now donating plasma and using your superpower. That's wonderful to hear. And we'll be sure to link information on how to donate plasma as well. So in case other people want to join Jennifer in those efforts, that would be great. So thank you, Jennifer. And thank you, Dr. Torrey and Dr. Talbot, for joining me today.
Thank you. Thank you so much for
having us.
Yeah, for allowing this.
Thanks very much.
In our next segment,
nice job, Jennifer.
In our next segment, we'll discuss the safety, efficacy, and distribution of the COVID-19 vaccine. To view past Heads Up Coping Through COVID-19, visit our website, go.d-h.org/headsup, and we will have those resources that we mentioned earlier. Thank you for watching. Please continue to wear a mask and stay healthy and stay safe. Take care.